My name's Terry. I'm going to be your nurse today. I'm going to close this door for privacy, but I'm going to let these students in. Can you tell me your name and your date of birth, please?
Joyce Marina KG, 1998, February 16th.
That's what I've got on my chart here and everything. Well, it's nice to meet you. Today I'm here and I'm going to be doing a head to toe assessment. Notice I'm raising the bed while I'm talking and doing things. May I call you Joyce?
Yes, ma'am.
Do you have any allergies?
No.
All right. So get this up a little bit. I see you have an IV here. It's going to be hooked to the pole there. Is that painful to you? You having any trouble with that?
No, that's okay.
Okay, I'm going to come over here. I need to check the fluids and everything against my chart. I see normal saline is ordered, and that's what you got, and it's at 50 mils an hour. Okay, so that's great. Today, I'm going to start by asking you a few questions. Do you know where you are today? Can you tell me?
I'm in the hospital, and today's Friday.
Wait, I didn't ask you that.
Sorry.
Don't get away from it.
That's okay.
Oh, okay. No, it's not. Is it? Can you tell me what the day is today?
Thursday.
And the
Fifth.
date?
5th.
Do you know about what the time is? Ready to go home?
4.
Around 4. Okay. That's fine. I can tell that you're oriented to time and place. And you already knew your name. So tell me, how many fingers do I have up?
4.
Okay, so you could see my fingers and you could hear my question and answer it. Give me a big smile. Face is nice and symmetric. That's good. I want you to put your finger on one side of your nose and breathe it in through the other side of your nose. In and out. Okay? Do the same thing. Flip that. All right. So you have a patent airway there. And that's good. Come on. Gonna look in your mouth now. All right. So open wide. All right. Good. Good. Now let me look at the top of your mouth. Okay. And underneath your tongue. Good. Everything. It's pink, moist. I don't see any signs of lesions there. Tell me, Joyce, do you have any pain today?
No.
On a scale, I'm going to rephrase it, on a scale of 0 to 10, with 0 being no pain and 10 being severe pain, how would you rate your pain?
0.
Well, you look calm and collected and smiley, so I don't see any symptoms of pain. What I'm going to do now is I'm getting ready to listen to your lungs, and what I want you to do is every time that I place my stethoscope down on your skin, I want you to breathe in and out for me nice and big, okay? Just cleaning this all off for you. All right, using your bed as a trash can. Here we go. In and out. Oh, wait. Oh, well, I mean, you can still breathe. I just didn't have that flip dry. Go ahead. Make sure it's on skin, not material. You don't want to listen over bone or the fullness of the breast. I'm going to come underneath. Today, because this is a video, I am not going to show you exactly where I'm listening. We're going to be knotted a bit. Hang on. Oh, I got it.
Okay.
I got it. There we go. All right. Okay. And come underneath and listen. Nice and deep. Good. And I'm going to come across. Sounds great. If you would take this hand, put it on this shoulder, I'll get your sides. Yeah, so I'm just not showing you. I may be on material, but you cannot have your scope on material. You'll lift this over to that side. Thank you. There we go. Sounded good. Make sure you listen. Will you sit up for me? Make sure you listen for a full inspiration and expiration. In and out. If you don't wait and give her time to breathe out, I take off all the points. Stay off the scapula. Stay off the spinal column. See, I'm watching for her whole back and chest to stop moving. One last one. Good. And sit back. Your lungs were clear to auscultation, anterior, posterior, and lateral. I didn't hear any adventitious sounds with that. I'm going to listen to your heart now, Joyce. Just relax and breathe normal. Okay? I'm going to find my location right here. And now I'm going to listen. Just relax. Whoa. That's beating fast. Okay, I'm going to come from underneath. Now, you guys with the videos, don't catch any of this for me, okay? I'm going to go under. I would be seeing skin here. I'm going to slip under. Better to do this from the other side of the bed. Listen with my bell now. And coming back up through the top. All right. Your heart sounds, I heard your heart S1 loudest at the apex, S2 I heard loudest at the base. I did not hear any extra sounds or murmurs, and your heart rhythm was regular. Okay, now I'm going to look at your abdomen. Now I know we haven't taught this yet, so you'll be seeing this week, next week as we teach this, okay? So you expose the abdomen. I'm not going to go below the belly button line here, but you're going to divide this into 4 quadrants. The very first thing that you do is you get down with your pen light and you're looking, and I'm looking for pulsations or anything that looks like a hernia or anything that makes the abdomen not symmetric, but your abdomen looks symmetric. I'm going to auscultate now. Make sure I flipped my stethoscope back from the bell, and I'm going to listen for bowel sounds. Sometimes it takes a few seconds. Ah, little gurgle. But kind of quiet. You won't have to spend too long with this. We'll talk about that next week. I would say that your bowel sounds are hypoactive in all 4 quadrants. Do you have any abdominal pain at all? Tenderness, anything? All right, I'm going to percuss. We'll learn about this next week. I hear tympani in all 4 quadrants. And would you bend your knees up just a little bit?
Okay.
Yep, both of them. Just relaxes your abdomen. I'm going to just palpate real nice and lightly. Any tenderness? Abdomen soft and non-distended. All right. Everything's good so far. I would say you are, oh, I don't want to do that one. I wanted to do this one. I would say I'm going to pull the covers back right now because I'm going to have to look at your legs. The color is a nice, rich brown color, evenly colored, and I don't see any signs of cyanosis or jaundice or anything like that. Your radial pulses are 2+ bilat. I'm going to check your temperature. I did that out of order. Warm. And I would go up under. You got to go up under here to get the upper legs nice and warm. So you're bilaterally warm all the way down. Your radial pulses I've done. Let's look at your cap refill. Cap refill is less than 2 seconds times 10. I want you to do what I do with your arms. Stretch them all the way out, over and back, up like this as far as you can go, out as far as you can go, and up about halfway. Now push against me, all right, and pull back. All right, muscle strength was 5 out of 5 bilat, and your range of motion was full range of motion bilateral on your arms. The other way to test muscle strength is, I'm gonna have you squeeze my fingers, okay? Squeeze hard. All right, 5 out of 5, and that's your other way to test. You only have to use one way. I'm gonna check for edema. Don't see any edema there, but if I did, I'd measure it with a centimeter ruler. I did that again. Let's check for your pulses. I picked up one fast. There's the other one. I would grade those as 2+ out of 3+. Cap refill on your toes. Pardon me, just squeezing a little bit. I can't see that one. I'll do that on the tip. Cap refill, less than 2 seconds times 10. Joyce, if I could, I'm gonna get you to just slide over to the edge of the bed, please, and dangle. Move up to the edge, thank you. Straighten your legs all the way out like that and bend them back as far as you can do it. I know the bed kind of keeps you. Would you push against my, okay, and pull back? So full range of motion in both legs. I'm gonna put you back to bed. Full range of motion in both legs and muscle strength 5 out of 5. There is another way to test muscle strength. And I'm gonna push on your feet. Now step on the gas, all right, and pull back. Muscle strength 5 out of 5. So you could do either way with that, okay? Now what I'm gonna do now, you can have time to think about if you've missed anything because it's getting late. I'm just gonna let it stand. I think, I have a bad feeling about something, but I'm not sure what. So who's grading? Okay. I know I went out of line on a couple of times.
Oh, the abdominal pain, you asked after.
I asked before I percussed and before I touched, before I palpated. So you get the point for that. Even though I mean, I could have asked at the very beginning of the abdomen, but just to show you, you don't have to do everything in exact, or if I'd forgotten it and I remembered it after I did the toes, I could come back and do that. We'll talk about the rest later. But anyway, so that's it. Anything else major did you see? You think I passed? Okay. All right. Thank you very much. Joyce, thanks.
You're welcome.
All right. I'm going to change the sheets on this bed. Are you glad to know you're the last person?